Good evening and welcome to the monthly series of our Kollel's Halacha Shiur, specifically Halacha L'Maseh. This month we have the merit to have with us Rabbi Weiss, Chief Rabbi of Montreal, and he's going to speak to us about medicine on Shabbos.
Shalom Aleichem to everyone. I understand that the Kollel was learning Siman Shin Kov Ches in Hilchos Shabbos, and I want to talk about first some basic issues and then go into detail some specific medical issues which can come up on Shabbos. So first, in Shulchan Aruch it says in Siv Beis, Mi sheyesh lo choilu shel sakonu, someone who is faced with a situation, there's a choile, a person who is in danger, a dangerous illness. Mitzvah lechalal uleves haShabbos. It's a mitzvah to be mechalal Shabbos. It's not only muter lechalal Shabbos, it's a mitzvah lechalal Shabbos. V'hazura is harayzei mishubach. Someone who does it urgently it's commendable. V'ashoyel, a person who goes asks a shayla if it's allowed or not. Harayzei shoyfer dumim. A person who hesitates because he feels he has to go ask a shayla, ask permission if he's allowed to do it, he's allowed to be mechalal Shabbos to save a life. Harayzei shoyfer dumim. It's similar to spilling of blood. It's taking a life. The Torah brings down from Yerushalmi that to this there's an addition which is omitted for some reason in Shulchan Aruch. We'll address that later on. Hanishal harayzei meguna v'ashoel harayzei shoyfach dumim. That not only is the shoyel shoyfach dumim, the person who asks the question is shoyfach dumim. Hanishal, that rabbi, that the question is being posed to him, is considered meguna. Is considered meguna. Why is that definition? Why is that placed on the Rav that's asked the Shaila? What did he do wrong? Why should he be called meguna, gnai? It's deplorable. It's not something which should be avoided. What's wrong with being asked the Shaila? The Magen Avraham writes, Anishal harayzei meguna shehoy lo lidrosh berabim shemuter. He should have lectured. People should know that this is allowed. So I thank you for giving me this opportunity to be doirish barabim that it's mutter. I shouldn't be considered meguna when someone would ask me this shaila. Now the Machzis Shekel adds on to that although the Magen Avraham brings this down from the Gemara, it's not a Gemara, it's basically a Yerushalmi. And the reason is because hoy lo lidrosh barabim, that the mukor for that, this explanation is basically a Trumas Hadeshin. Why is it omitted in Shulchan Aruch? Why, when the Mechaber brings down this halacha, he only talks about the shoyel, he doesn't talk about the nishal? So there's a beautiful explanation, Shalosh Tshuvas Tzitz Eliezer, and Chelik Tazayin, Simet Tazayin. He first brings down additional explanations why the nishal is meguna. The Precious writes, the nishal is meguna because we're probably talking about a Rav that is makpid, everything should be asked to him. He doesn't like when people decide on their own shailas. And he's makpid because of kvoidoi, that people should ask everything. So, this is meguna. A person doesn't have to be makpid if it's something which is so straightforward that Chilul Shabbos is a mitzvah and it should be done. He shouldn't be makpid al kvoidoi, that people should ask him everything. So that's one reason why this can be meguna. But in Tashbitz writes another reason what Chazal meant when they said Hanishal Arayze Meguna. When a Rav is posed with this question, if Chilul Shabbos should be done in such a situation, and let's say someone comes over to a Rav and says, I have this and this situation at home, can I call an ambulance? If this Rav says, yeah, you go ahead and call an ambulance, but instead of him dialing the number and calling himself, that's Meguna. Why didn't you go to and do it yourself? Why are you telling the other person to do it? This Nishal, if he only remains a Nishal, and it's not the person doing the act of Chilul Shabbos to save a life, that's Meguna. Because Hazores, Harayze, Mishubach, in the Shulchan Aruch it says that this type of actions should be done by Gedolei Yisrael to show that it's not only a heter, it's a mitzvah. That's this type of Rav that's only Begeder Nishal, he's Meguna. So says the Tzitz Eliezer. So we see from this that the reason why the Nishal is Meguna is because it's part of the Tzivui to be Zuris Harayze Mishubach. So he was mezalzel in the Zuris Harayze Mishubach, therefore he is considered Meguna. So says the Tzitz Eliezer, since the Shulchan Aruch stressed that Hazuris Harayze Mishubach, the only problem is Hashoyal Harayze Shoyfach Dumim, because in the time he went to ask the Shaila, a life can be lost. But this part of the Nishal, which is basically a result of the lack of Zrizus, of Zuris Harayze Mishubach, and since the Tzivui of Zuris Harayze Mishubach is already mentioned in the Shulchan Aruch didn't feel a need to mention the result of it, of the Nishal Harayze Meguna. Al Kapunim, this is an introduction of the importance to talk about these issues, especially if we have in the call Hatzolah members, which this is their trade to be Masl Nefoshes. It's Baruch Hashem that we have this opportunity to talk about these issues, and so that none of us should be begeder Hashoyel Harayze Shefach Dum Cholila V'Anishel Harayze Meguna. The first few seifim in this siman talks about various situations which might be considered pikuach nefesh. In Sif Gimel it says, Kol makah shel chulal, any internal wound, da'aynu min hashanayim v'lefnim, an internal means from the teeth inwards, v'shanayim atzmon b'chlal, mechalelen uleyu es ha-Shabbos. V'davke sheniskalkol echad ma'ayvrim apnimiyim, machmas makah, oy bu'ah, so here we see that an internal wound is considered pikuach nefesh. Mechushim ba'alma einekrom nefesh, einekrom makah, meaning a simple stomach ache or internal ache is not considered sakuna, but if it's a wound, then this is considered sakuna. And then we see in Sif Dalet, makah shel chulal eino tzrichu oimid. We don't have to diagnose and ascertain that a certain wound is considered dangerous. There's no experts. And the patient isn't complaining that it's dangerous. We have to do anything we would have done in a weekday, we have to do on Shabbos, even if it entails Chilul Shabbos. Unless we know for sure that this condition is not dangerous, then we're not allowed to be Mechalel Shabbos. That means whenever we're in doubt and we know that there's an internal wound, Makkah Shel Chulal, this is considered potentially dangerous, and this person should be handled as if his life would be in danger, and you have to be Mechalel Shabbos. And then Shulchan Aruch goes on in Sif Zayin. It also lists another few conditions which are Mechalel in Shabbos. And there it says, Kol makah shenasa machmas barzel, any wound caused by a metallic object, al shchin habu befi hatabas, that's a rectal boil or a wound. Al simta vinikra felunkra blaz, and we'll talk about it later at length. That's considered like a furuncle or it's a boil. It's an abscess, an infection. Valmi sheyesh boy kadachas cham beyoser, high fever, oy im simur. Simur is uncontrollable shivering. All these are considered sakuna. And of course, if it's a sakuna, you have to be mechal Shabbos. Now, I want to take a closer look at these various types of conditions and see that there is a difference how we relate to some mentioned the Sif Gimel Dalet and those in Sif Zayin. But first, the Shulchan Aruch spoke about Makkah shel chulal min hashanayim velefnim v'shanayim atzmom kelefnim. Meaning, if there's a wound with the teeth or more internal than the teeth, that's considered Makkah shel chulal. And the Torah brings down a specific condition which is called in Chazal tzafidne. When a person has a machle, a disease which is called tzafidne, he is in a dangerous situation, and you have to be mechal Shabbos. What is tzafidne? It has to do with the gums, bleeding gums, and if a person has bleeding gums, this can be considered a dangerous situation which needs chilul Shabbos. So the Bach asks, why does the Torah have to mention specifically this machla which is called tzafidne? Since the Torah already mentioned that hashanayim atzmam v'shanayim milifnim min hashanayim v'lifnim v'shanayim atzmam kelifnim, that the shanayim, anything has to do with a disease with the teeth, is considered Makkah shel chulal. Why does he have to add tzafidne? Tzafidne is another manifestation of that type of disease. So why does he have to mention it? The Bach brings down a very important point, and he says, when Shulchan Aruch states that that min hashanayim v'lefnim has a din of Makkah shel chulal, the default of a Makkah shel chulal is pikuach nefesh. But when the doctor says that his condition is not dangerous, there's no danger to his life, we're not allowed to be mechal Shabbos for Makkah shel chulal. But here, tzafidne is different, because tzafidne is a condition which Chazal designated as being dangerous. And if they determine that this is a dangerous condition, no doctor can overrule that. So if we determine that this person has tzafidne, even if we know, or the doctor knows, that he doesn't think there's a danger to his life, we have to be mechal Shabbos. Because when Chazal determine the person, he's definitely in sakonas nefoshes, then we don't take in consideration what the doctors say. We have a big chiddush here. Here we see that all those conditions where Chazal determined that that condition is a dangerous condition, even if when the contemporary medicine holds differently, we do not accept that, and we have to be mechal Shabbos. The Prima Gudim in Sivkut and Beis, in Eichel Avrom, brings down the same ruling, that tzafidne, even if a choyle v'haroife omrim, ein tzurich, both the doctor and the patient say, I don't feel my life is in danger, sheker omrim, they are lying, they're mistaken, let's put it more gently. They don't know what they're saying. Why? Ki mekubel b'yad Chazal shesakuna hu. But when the doctor says it's not dangerous, we don't have to be mechalal. But tzafidne is different, because that's mentioned in Chazal as being a sakuna. And this psak is brought down in Mishnah Brura too, in Sivkut Meches, that machalat tzafidne, why is it dangerous? Shemascheles befeh u'mesayemes bebnai ma'ayim. It starts in the mouth, but it can continue and affect the internal organs, and therefore it's considered as a dangerous disease, and you have to be mechal Shabbos even against the opinion of the doctors. And with this, it's different than Makkah Shel Chulal. But Makkah Shel Chulal is only the default. When we don't know what his condition is, it's Sakuna and you have to be Mechal Shabbos. But if we know that his condition is a known condition and it's not a dangerous condition, you're not Mechal Shabbos. So we have three famous poskim that establish this very interesting rule that when there's a clear definition of Chazal that it's a Sakuna, we don't take into account medical opinion. But not everyone holds that way. In Tehillah Ledovet Sivkut Zayin and Sivkut Ches, he's Medaik from Lushn v'Shulchan the Shulchan Aruch is cholik on the Bach. Why? Because why did the Shulchan Aruch didn't mention Tzafidna? If this is such a concept, an ironclad concept, that Tzafidna overrides any other medical opinion, why didn't the Shulchan Aruch mention it? And he brings down, in Sif Vov, we learn, Makash al Gavayad v'Gabaregel, Misha Bula Aluka, in another few. And the Shulchan Aruch concludes, Arayze K'Makash Shel Chulal. We already learned that Makash Shel Chulal is only when we're in doubt, is it a Sakuna. But when we know for sure it's not Masukan, it's not a Sakuna. But Makash Shel Gavayad v'Gabaregel is brought down in the Gemara as Makkah Shel Chulal, but Misha Bula Aluka, Misha Noshche Kelev Shoita is no mention that it's Makkah Shel Chulal, and only as a Sakuna. So we see that the Shulchan Aruch brought together two classes of conditions, dangerous conditions, which according to the Bach don't belong in the same class. Some of them are only Makkah Shel Chulal, others are clearly dangerous and Sakuna, and Shulchan Aruch put them together in one class, in one sif. It's a simon that the Shulchan Aruch did not feel that there's a difference between these two classes. And every situation has to be judged from a medical perspective. And if the medicine feels that it's not dangerous, we shouldn't be Mechal Shabbos. So we have a Machlokas here. On one hand, the Tehillah Ledovet is Medaik for Shulchan Aruch that he disagrees with the Bach. On the other hand, we have the Bach, the Pri Megudim, the Mishnah Brura, and the Poisek Achron is the Mishnah Brura, and they all feel that when it comes to a machla of Tzafidna, we have to be Mechal Shabbos, even when doctors say it's not a dangerous condition. Of course, when it comes to Sufik Pikuach Nefesh, we have to go L'chumra and not be Machmer Basufik Sakuna. So we have to accept the ruling of the Mishnah Brura and the other poskim that when we're dealing with a clear situation which is mentioned in Chazal and Shulchan Aruch, then we have to relate to this person as a Choyle Mesukan, even when a doctor's opinion is that it's not dangerous. What is basically what we know about this Machlas Tzafidna? What is it? It's difficult to take medical knowledge we have now and to define something which Chazal gave us very few symptoms to judge what we're talking about. But the Lushon in the Gemara is, how does a person know that he has Tzafidna? When he takes something and he pushes it between his teeth, it starts bleeding. So it seems we're talking about a gum-related disease. Some contemporary poskim wanted to explain that we're talking about a condition which is called scurvy. Scurvy is something which isn't known, Baruch Hashem, nowadays, because in history there was a very common disease which was a result of a lack of vitamin C. And Baruch Hashem, now everyone has access to vitamin C. If it's not from oranges, it's from some vitamin supplements people are taking. In any case, scurvy is not known. Those people that used to sit on ships weeks and months long from the transatlantic journeys, they used to suffer from scurvy. And scurvy, one of the symptoms of scurvy is it's a gum disease. But then we have to, it's a bit difficult to understand what Chazal say. It starts in the gums and it can end in the internal organs. The gomeres b'bnai ma'ayin. So the accepted explanation of Machalas HaTzafidna is what is known today as periodontal disease. Periodontal disease is an infection of the gums, and the bacteria that affect the gums can spread and infect the lining of the heart. We have a cardiologist here in the audience, and this is quite commonly known that the same bacteria that affect the gums, if, for instance, if an extraction is done while there's an active infection, this can cause the bacteria to enter the bloodstream, and they can attack the lining of the heart, which is called endocarditis. So this can be a very dangerous situation. And this possibly what Chazal meant when they said mascheles bepeh vegomeres bebnai ma'ayim, meaning the internal organs can be affected if this condition is not treated properly. So when a person has this condition, he is definitely considered as choyle sheyesh b'sakuna, and whatever he needs to be done for him, for his health in Shabbos, should be done even if it entails chilul Shabbos. When Chazal spoke about min hashanayim velefnim dinoi kemaka shel cholol v'shanayim atzmom kelefnim, that means when a person has a toothache, but it's not a toothache enough is not enough. We're talking about an infection in the tooth, which penetrates the roots of the teeth. Normally this is treated with a root canal, but in children we can see it quite often when a child still has the infant teeth, the milk teeth as they're called, shinei chalav. If they develop an infection in one of the teeth, the whole face can be blown up. It happens very quickly. Or they can have a boil on top of the tooth like a balloon. And that's definitely what is considered makkah shel cholol mishanayim velefnim. And unless a dentist says it's not dangerous, it has to be seen as a dangerous condition. It has to be treated immediately with antibiotics, or if necessary, it should be, maybe the doctor will want to lance it and to drain the pus. In any case, this is definitely considered a makkah shel cholol. Let's go over now to Sif Vuv. In Sif Vuv, it says as follows: Makkah shel gav hayad vegav haregel. A makkah that's on the back side of the hand and the foot. V'chain misha bula aluka. Aluka. How do you? What's the translation in English? A leech. Yes, someone who swallowed a leech. A leech is a bloodsucker, and people used to use it for medicinal reasons. Leeches. But if a person, a piefke heißt es auf Yiddish, a piefke, they used to do it for high blood pressure, like bloodletting in Bismana Gemara. But someone who swallowed a leech, it's a dangerous condition. Someone who was bitten by a wild dog. A wild dog means a dog that can have rabies. Or he was bitten by one of the creatures which have venomous creatures, like snakes, poison snakes, or scorpions, or maybe spiders. There are some spiders which are venomous. Even if there's a doubt if this snake is venomous or not, so here the definition is makkah shel cholol, meaning that when we're in doubt, we have to be mechal Shabbos. But if we know for sure that this is not dangerous, for instance, we know for sure that the dog does not have rabies, or the snake is a non-venomous snake, then in those conditions we don't have to be mechal Shabbos. We saw before that according to the Tillel Duvet, all the conditions are in this class, but according to the Pri Megadim and the Bach, there is a difference of opinion. And there are certain types of conditions which are always mesukun, and some which are dependent on the medical opinion. Now, this is a very interesting klal. Makesh al gav hayad vegav haregel is a sakuna. In Sefer Nishmas Avroam, he wonders why people, even hachareidim lidvar Hashem, Einu makpidim lechalas Shabbos lefi hatzorich al kol petza o makash al gavei ad oregel. If a person has a wound on the back of his hand, he's not mechalas Shabbos. Why? It's a Ferish Gemara, Ferish Shulchan Aruch. And then he says, the possible explanation would be, since we see that when it comes to makash al chulal, we do rely on a medical opinion, because makash al chulal, as I said before, is only the default. When we don't know, then we're mechalas Shabbos. But if we have a definitive medical opinion saying that this condition, although it's b'chulal, is not dangerous, we don't have to be mechalas Shabbos. So since, and it's different than tzafidna, which is in any case mesukn. So he says, since we all know that the doctors don't see a difference if the wound is on the back of the hand or on the arm or in the foot or anywhere else in the body, so this is like a clear diagnosis or a clear opinion from the doctors that this is not a dangerous condition, and that's the reason why we don't take that so seriously, because it's an accepted ruling or accepted approach that this type of wounds are not dangerous. So therefore, you're not allowed to be mechal Shabbos when it's a simple wound on the back of the hand. In Sif Zayin, Shulchan Aruch says, "Mechalel and Shabbos al kol maka shenase machmes barzel al shchen abu b'fi hatabas al simta." And the makar for this halacha is maka shel barzel, where there's a wound that's caused by a metallic object is considered it's considered dangerous. Here, there's no mention of maka shel chulal, meaning it's a definitive ruling of the Chazal that a maka shel barzel, a wound caused by a metallic object, is considered dangerous. So it seems, according to the ruling of the Pri Megudim, that this type of wound, it doesn't help if the doctor says it's not dangerous, because this is clearly defined by Chazal as being dangerous. And the Mukar of this is a Gemara in Avodah Zarah Kuf Ches Amud Aleph. The Gemara says, Omer Shmuel, Hai Padase, Skantehi. This wound, which is called Padase, Pei Dalad Ayin Tuf Aleph, Skantehi Mechalelen Uleos Shabbos. Perish Rashi explains, what is this Padase? Petza Makas Cherev, a wound which is inflicted by a sword. Makas Cherev. So here we see in this sif that the Shulchan Aruch does not mention Makas Shel Chulal. So the Pri Megudim here writes again that everything mentioned in this sif, even when the Reifa or the Choyle say, I don't need treatment, this is considered skuna v'ayin shamalhem, and it's similar to tzafidna. The Isser v'Heter and others ask a very interesting question. Bris Milah is done with a knife. Yeah, we take and we do a Milah on Shabbos. And a Bris Milah is Baruch Hashem not a skuna. We do it all the time. That's not a skuna. Why isn't this considered a Makkah shel barzel? So his explanation is the Isser v'Heter, that although it's a Makkah shel barzel, it's a knife, but it can't be worse than a Makkah shel chulal. And just as the same as we find by Makkah shel chulal, that when doctors say it's not dangerous, we don't have to be mechal Shabbos, the same applies to Makas Cherev. We see clearly that he's going against what the Pri Megudim and the Bach wrote, because the Pri Megudim and the Bach were saying that Makas Cherev is in Sif Zayin. In Sif Zayin there's no mention of Makas Shel Chulal. In a Sif Zayin it's not dependent on a medical opinion if it's dangerous or not. So therefore, anything mentioned in Sif Zayin which includes Makas Shel Cherev would not be dependent on saying it's not dangerous now. We don't have the power to say for something which Chazal defined as being dangerous, that we should say we disagree and we don't feel it's dangerous. So we need another explanation. Vusamit Mila. How do we do Mila? If Makkah Shel Barzel is dangerous, is a sakuna, how can we inflict such a dangerous wound on a child?
We treat it, huh?
Yeah, but
with a bandage, with a medicine.
yeah, but okay. So we're saying basically it is dangerous, but we're doing it. But it's okay. So the Bir Halacha has another explanation for it. The Bir Halacha brings down for Kiva Eger. He brings down from the Tvir Shar. The Tvir Shar is mistapek. This is the illusion of Bir Halacha. The Tvir Shar is mistapek. He asks a question. This Halacha Makas Cherev is a dangerous condition if it's only when this Makas Cherev was inflicted powerfully, in a traumatic way, or even when it's a gentle cut, it's also considered a sakuna. And let's look at a different situation which is dependent on the shaila. A person macht a hoiche brucha, moitze lechem and uretz, fratik tzanachts, and he cuts the challah, and he slices into his finger. Is this pikuach nefesh? It's a small cut. He puts some pressure on it and stops bleeding. Are we supposed to call hatzola? We have to go to the hospital or not? He doesn't need stitches. You don't really need anything. Maybe a bandage, but nothing more serious. But it's a makashel barzel. The knife is barzel. No, is this considered pikuach nefesh or not? Basically, this is the shaila of the Bir Halacha. Is makas cherev only when it's a traumatic incident, meaning like a person gets hit by a sword, or it's only even when it's a gentle cut or a prick with a metallic object, it's also considered a sakuna. From the Lashon of Bir Halacha, it seems that he's mistapik. But when we take a look at this, Tvor Shor himself, he seems to be noite lahachmir, that even a chitach leloi koyach is also considered sakuna. That's the mashmos from his Lashon. But in Kreisi Aplaisi, Rabbi Yonasan in Sivkot and Hay, in Hilchos Treifas, he writes very clearly that when a person is cut, not by a sword, it's not so painful, it's not dangerous. The mile yoichiach, he brings a raya from mile. It heals very quickly and very simply. So how can you say that's a makashel sakona? But if this makas cherev causes wounds in the flesh, like a person is hit with a sword, that's the Lashon makas cherev. He has to be hit by a sword. So according to the Plaisi, it's a major difference between a gentle cut or when a person is hit by it. And the Aruch HaShulchan is of the same opinion. Aruch HaShulchan in Sif Chovov also holds like the Plaisi. He writes, Yesh Misha Mistapek Ibin and Dafka Bekoyach Afilu Shloi Bekoyach Velin Nere Dafka Bekoyach. And he brings a raya from the Lashon of the Gemara. The Gemara, how does the Gemara define makas cherev? Padasa. And Rashi says, Petza makas cherev. Maka means someone is hit by a cherev. And he brings down the Targum on the posuk Petza tachas potza, writes Pid'u chalaf pid'u. So Petza in the Torah means a powerful wound. And brings another raya from the posuk in Mishlei. So we have another posuk here that differentiates between a makas cherev, which is with a forceful, a traumatic, a person is wounded with a metallic object, or if it's only a gentle wound. He also writes the same. He writes as follows: if it's a chatach kut and if it's a small cut and he can stop the bleeding, it's not a problem. And he continues, if it's not a big or deep wound, he talks about a finger prick. If it's only in the skin deep and it's some pressure applied stops the bleeding, so it's not dangerous. But if it's a deep wound, if an artery was affected, then it's very dangerous, because that can cause uncontrollable bleeding. And the yeshboy kadai lehumis, afilu imhu machat imizrev zurif. That's called a puncture wound, which is also very dangerous. So we see the poskim, most poskim differentiate when dealing with a makas barzel between two types of makas barzel. If it's a superficial wound, it's not caused by force. This can be treated simply by applying pressure, by cleaning the wound, and by applying a band-aid. But if it's a deep wound, it's a wound caused by force. It's like a tear wound where the flesh tears, or it's a puncture wound. Those are what the poskim are talking about, makas cherev, which is a dangerous condition, and he has to be brought immediately to medical attention. The same maskuna is in Ktsois HaShulchan and also in Shmir Shabbos Kelchusai. But I want to add that all this is when the metallic object was a clean one. But if it wasn't clean and there's a danger of tetanus or of infection, that is of course a dangerous situation which has to have immediate medical attention. I want to bring an interesting raya to this approach, that there's a difference between a forceful wound with a metallic object or something which is done with a knife, not with force. There's an interesting Gemara in Bruchas Daf Ches Amud Beis. The Gemara says there as follows: Omer li Rova lebonai. Rova instructed his children, Kish'atem chatchem busar, when you're cutting a piece of meat, al tachtuchu al gavayad, don't hold the meat in your hand while you're cutting it. Meaning, you have the meat in your hand and you cut this way, that's dangerous. Why? It's dangerous. You can cut yourself. If you cut into your hand and it's going to bleed and it's going to mess up this piece of meat, people won't be appetizing too much. So that's good advice. Don't do it. Rashi says, what skuna is he talking about? So Rashi says, he might cut off a part of his hand. Chaz v'sholom. Kilkel suda. What does the kilkel suda mean? Even if it's only a prick and some blood, he will bleed a bit. The blood can smear the piece of food, so people won't like it. So what do we see from here? Rashi couldn't find the sakuna other than he might cut off a piece of his hand. Yukatz yudoi. Why not makashal barzel? If a superficial cut is also a sakuna, why did Rashi have to go and explain an extreme situation where a person amputates part of his finger or hand? Why did Rashi say if he's going to cut into his hand, that's a sekonim, because it's a makas barzel? So we see from here that when a person is cutting challah and he cuts in a bit into his finger, that's not a sekuna yet. But the sekuna might be if he can lose part of his finger, chaz v'sholom. But otherwise, if it's not a forceful cut, if it's not a cut which penetrates or a puncture wound, this is not considered a sekuna. Let's go on to in the Sif. Shulchan Aruch continues and says, Mechalel in Shabbos al simta, v'hu hanikru felunkru belaz. That's the Lashon of Shulchan Aruch, felunkru. The Taylor Ledovit says, it brings down from Shulchan Atzai Shittim, that there's a correction here. It should have said farunkel. If someone is familiar with medicine, farunkel is a known type of boil. It's an infection in the skin which develops into an abscess and has pus, and he says it's called in Polish cherik. So maybe, I don't know if many people here know Polish, But in Polish, czerek means pus. So if there's accumulation of pus in an abscess, that is considered furunkel, which is, according to Shulchan Aruch, a dangerous condition. So in the Teilu Dovet is Messiah, and he says, "U'be'emes yesh b'min zeh nikro carbuncle." There are this type of infections that are called a carbuncle. V'umaka mesukenes ma'od. It's a very dangerous makkah. So according to the Teilu Dovet, in Shulchan Aruch, when we're talking about a furunkel, probably means a carbuncle. What is the difference between a carbuncle in a furuncle? In the Gemara it says as follows: Omer of Safra, hi invese. When we have on our bodies something which looks like a grape, it's probably a pus-filled abscess. Parvanke de malacha de moisehi. It's a shliach of malach hamovas. It's a dangerous situation. And Rashi says invese. What is this invese? Ababua, it's a blister. Hadoimele inve, it looks like a grape. Parvanka de malach de misoisehu, kloimer mesukan hi lahumis. And Ruva adds, haisim to parvanka de ishtehi. So, looking a bit into it from a medical perspective, the furuncle basically is called a boil, B-O-I-L. It's a local infection which causes accumulation of pus. A carbuncle is a group of these type of small boils which can be combined and become a very large area of this accumulation of pus. And the way to treat it is by antibiotics. Sometimes, if it's massive, it has to be drained. It's lanced and it's drained, but it has to be done by a doctor. The danger of it depends on the size of it and where it's located in the body. It can be in a sensitive place, like next to an eye, next to in the face, which is close to the brain, which is much more dangerous than when it's in other parts of the body. And it also depends if the patient has developed fever or if there are red streaks coming out of it, which means that the infection is spreading through the bloodstream. And this chas v'shalom can develop into a sepsis, which is a very dangerous situation. It can also develop into a condition called cellulitis. And cellulitis is also a dangerous infection which has to be treated immediately by intravenous antibiotics. So all these might be included in this class of conditions which the Shulchan Aruch called carbuncle or furuncle. How much time do we have left?
All night.
Should we give time for some questions and answers? Yes.
Let's say if someone has, even though let's say it might be a cut, that it's something that requires stitches on Shabbos, can he be sent to the hospital for stitches or gluing?
Well, it depends if there's a danger of infection. If there's a danger of infection, yes, this can be considered a dangerous situation. But now we have very good Hatzalah members. Some of them can even tape together a minor cut. And what is there's a gray area when it comes to how do you call it? A situation where it doesn't involve danger, but it involves cosmetic. It's a young girl, and the cut is on her forehead, and if it's not done correctly, it might leave a scar. Cosmetic reasons is not a reason to be Mechal Shabbos. But if there's a danger of infection, yes, absolutely yes.
But then again, one doesn't really know if it could get infected, it might not, depending.
If it could get infected, then it's a sufik pikuach nefesh. If it could get infected, but if it's very small, and we have in our area we have some Hatzalah members that can put on the butterfly and treat it very nicely.
No, I understand that, but sometimes it depends. Again, it depends on how deep it is.
Exactly.
So,
You know what's very frightening when blood splashes all over the face? It's a very superficial wound because of the skull and the skin on the forehead is very vascular, and so even the smallest cut can look like a lot of bleeding. No, but that's not really dangerous.
No, that I understand.
Yeah, but people get hysterical when they see it.
No, I'm on a solo, so I understand that. I'm just asking in certain times.
Oh, when there's a gray area, when you're not sure, then you have to be machmer and go to the hospital. But what happens is you go to the hospital, you sit in the emergency for 8 hours, and then no one looks at you.
Something else.
Yes.
If this sakuna is, I mean, you can
Please speak up. I don't hear you.
technically delay it till after Shabbos.
Yes.
Nowadays, especially, that you can, like, for example, with antibiotics, you can retreat it, so it's not going to end up becoming a danger. That means, do I have to be Machal Shabbos today? If I don't treat it today, like, I can wait till the day.
The Lashon of Shulchan Aruch is v'ainoi mamtin. It cannot wait. But that definition, if it can wait or not, is not up to a layman. This a doctor has to decide, because sometimes you can miss the boat by giving antibiotics later. Maybe you have to start antibiotics immediately. So I wouldn't take that decision on myself. I would ask a doctor.
And when you say you gave the definition of barzel, you made the difference between hard,
Forceful,
or the question is, is there difference barzel and not barzel? Like, what if it wasn't barzel? Would the same didn't apply?
Hit you over the head with a piece of wood.
Yeah. It's a good question. Good question, because barzel was defined by Chazal, but absolutely, if the wound was caused by a brick wall, it can be just as dangerous. So we have a lot of conditions which weren't mentioned in Shulchan Aruch, but we have to take into account what medical knowledge knows.
Just an example.
What?
Barzel is just an example.
No, Barzel is even when the medical opinion is that it's not dangerous, because Barzel is mentioned. But something which isn't mentioned, a child runs and runs into a brick wall and opens his forehead, it's also dangerous. Maybe just as dangerous. So absolutely, such a situation has to be treated immediately. Yeah.
Yeah, if you have splinter cuts, it looks like it could become infected. You may not want to bring Shabbos to pick up the phone, so call Hatzalah. I don't know.
Well, we can't say that every hysterical mother or father is qualified to decide if something is dangerous. You have to ask someone who is more knowledgeable. A small splinter probably isn't dangerous, and you can remove a splinter on yourself, and without having it treated in the hospital.
You can use a needle in Shabbos.
A needle or tweezers, just try to pluck it out, and you can even do it without causing any bleeding. But it has to be cleaned with antiseptic. But that shouldn't be considered. But if it's something deeper, or it depends. You can't give it.
They sterilize the tweezer by holding it over the fire, but that later wouldn't be allowed on Shabbos.
No, you can sterilize it with alcohol or something, an antiseptic.
But based on your question, based on what you were saying earlier, a piece of metal that you inflict yourself with, sort of like what you were saying of brismillah, it's self-inflicted, so it doesn't count, right? Does it sakana?
I didn't say self-inflicted doesn't count. A person can self-inflict a serious injury. What I said before is the difference between something superficial or something done gently, like when a person cuts challah and he by mistake gives himself a prick. That's not dangerous. But of course, if it's done self-inflicted, a powerful wound, it's dangerous.
So if you take that tweezer or whatever you're using, that metal object, to try to pry something stuck inside, like a wood splinter.
Right.
That's okay?
Yes.
Because you're doing it gently?
But you're not causing a wound. You're taking out a splinter.
But on Shabbos specifically, you're allowed to do that on Shabbos?
Yes. You're not. Now, if you'll cause bleeding without question, this might be considered psikreisha. But it's a melucha shein tzarich legifa. We can go into the lamdas of it because you really don't need the bleeding. You know when drawing blood is a melucha d'oraisa, when you draw blood because you need that blood for a blood test, or you need the blood to see if you're in the vein, then that's considered a melucha d'oraisa. Otherwise, it's a melucha shein tzarich legufa. You don't really need that blood. The melucha is drawing the blood, but you don't really need that blood because you're trying. For instance, a person has to have an injection on Shabbos.
Or diabetic.
Or diabetics. No, diabetics needs the blood. That's melucha d'oraisa. Because the diabetic wants to check the blood sugar, he needs that drop of blood to check himself. So that's melucha d'oraisa. But when a person has to inject himself with insulin or inject any other medication he has to need, if this is an subcutaneous or intramuscular injection, and if it can be done without causing bleeding, it's mutter, because it's a duvashanim schab. Duvashanim schab is mutter unless it's a psikreisha. But if it's definitely going to cause bleeding, it's an issa d'rabonan.
So a person who's diabetic who needs to take an insulin shot in the morning on Shabbos, is it better for a goy to do it, or is the person himself allowed to do it?
It depends how he's classified in the family of diabetics. There's type 1 diabetics. Type 1 diabetics are always considered cholish yesh b'skuna. They have to keep on monitoring themselves a few times a day, and those medications have to be given a cholish yesh b'skuna. He has to be taken in a normal way.
Type 2 also has.
What?
A type 2 diabetic also has to take.
Not always.
Know what his blood sugar is. He has to take insulin, otherwise he could.
Judge Zaino, the type 2 is a very broad definition, and we have type 2s that are controllable with diet, without medication, and then we have simpler medications. The type 2s normally don't take insulin only when it's an